Hi, Mr. Doe. Hello, my name is Daniel Butcher. I'm a PA student at Free University of Cumberland. Give me just 1 second. Let me wash my hands. We'll go ahead and get started. Alright, would you mind telling me your full name, okay, and date of birth? And let me see if your number matches up with mine here. Okay, we're good to go. So you're here today for a male exam. Does that sound right? Alright, great. So first thing, I'm going to give you just a quick rundown of what we're going to be doing today. I'm going to inspect your penis, scrotum, and scrotal contents, and then I'm going to move on to check for hernias, and then lastly I'm going to do a rectal and prostate exam. Okay. So this entire time I'm going to make sure that I'm gloved, and the patient will be gowned or draped to cover the abdomen and chest, and I'm going to be seated in front of the patient, and the patient will be standing, but for the purpose of this exam the models don't stand up, so I'm just going to have it laying there on the bed. Okay. So first thing we're going to do is we're going to inspect the penis. So we're going to inspect the skin first and check for lice or nits at the base of the pubic hairs. Okay, now we're going to inspect the prepuce. So to do this, either me or the patient would retract the prepuce, okay, and then replace it. And all it's doing is just checking for any underlying carcinomas or chancres that may be missed otherwise if you don't do that. Okay, now I'm going to inspect the glands and the meatus, okay? And so we're going to be looking for ulcers, scars, inflammation, and nodules if present, and also we're going to note the location of the meatus. Okay? And now I'm going to palpate the meatus by compressing the glands between my thumb and index finger. This model's kind of key, so anyway, so we would compress there, and that would actually open the meatus for us. Okay, lastly, I'm going to palpate the shaft of the penis between my first 2 fingers and thumb. Okay? And we're going to note any induration or tenderness if present, and we would omit that step in a young asymptomatic patient. Okay, so now we're going to move on to inspection of the scrotum and scrotal contents. So first, we would lift up the scrotum. Okay, this is kind of tough to do on this model, but anyway, so we'll lift up the scrotum and look underneath it on the posterior side and note any swelling, lumps, or veins present. And then we're going to just inspect the contour of the scrotum to see if either one or both sides are underdeveloped, which could indicate possible cryptorchidism. And also we're going to inspect for swelling, which could indicate an indirect inguinal hernia or a hydrocele. Okay, now we're going to move on to actual palpation of the scrotal contents. So first we're going to locate the epididymis, which is on the superior posterior portion of the testes, and it should feel nodular and cord-like. Okay. So now I'm going to palpate each testicle and epididymis between my thumb and first 2 fingers. Okay, and we're going to note size, shape, consistency, tenderness, and nodules if present. Okay, and now I'm going to actually palpate each spermatic cord on both sides, including the vas deferens, all the way from the epididymis up to the external or superficial inguinal ring. Excuse me. Okay. Other side. Okay, good. So now, if there was to be a mass or swelling outside the testicles, then we would go on a transillumination. And so to do this, I would actually shine a light behind the patient's scrotum through the mass. And normally light should transmit through the scrotum and have like a reddish glow. But if it's blood or tissues present, then it will not transilluminate at all. Okay, so now we're done with the scrotum. We're going to move on to inspection of and look for hernias. So again, I'm going to be seated and the patient will be standing for this. So first we're going to check for inguinal hernias. And first thing I'm going to do is put the tip of my right index finger on the inferior portion or margin of the scrotum. And I'm going to be checking for a right inguinal hernia. And so I'm going to press upwards towards the inguinal canal. Put pressure here. Press upward towards the inguinal canal, invaginating the scrotum. Okay. And I'm going to have the patient, or I would locate and palpate the external inguinal ring, which should be lateral and above the pubic tubercle. And then I would have the patient bear down or have a Valsalva maneuver, and you would feel for a bulge that may move into the inguinal canal. Okay, and then we would just repeat the same process on the left side with my left hand. Okay, good. All right, now we're going to check for femoral hernias. So for this, to check for these, I would place my hands on the anterior thigh. Around where the femoral canal is, and again I'll have the patient cough or Valsalva and check for any tenderness or swelling if present. Okay, and these are below the inguinal ligament, and also they're lateral, and they never terminate into the scrotum. Okay, So now we're going to move on to the rectal and prostate exam. So for this, I would have the patient still stand, but I would have them actually in their upper body over the table, put their elbows down on the table. So for the purpose of this, I'm going to actually flip the model over like this. Okay, good. All right. So now, first of all, actually, we're going to inspect first. So again, so I have the patient positioned correctly, and we're going to inspect the sacrococcygeal and perianal areas for excoriations, inflammation, ulcers, or any swelling, inflammation, nodules, or anything like that that's present. Okay, good. So now I'm going to actually have the patient bear down and inspect the anus for any lesions if present. Okay, good. Now I'm going to go ahead and lubricate my finger. Okay. Okay. So lubricate my finger, and then I'm actually going to have the patient strain down, and I'm going to insert. Okay, ready? So strain down, go. I'm going to insert the tip of my finger in no sphincter tone. Okay. Okay, and then I'm going to insert my finger all the way, or as far as it can go, and then I'm going to now feel the posterior surface of the prostate, and feel the lateral lobes and median sulcus, and note any tenderness or nodules if present. Okay, and then I'm going to move my finger in a clockwise and counterclockwise motion to feel as much of the rectum as possible. Okay, and we're going to try to feel for any lesions, nodules, or induration if present. Okay, and then also if there was a lesion present, then I'd have the patient strain down to move the lesion closer to my finger. Alright, once that's done, then I'm going to withdraw my finger, and then I'll give the patient something to clean themselves with. And then if there is fecal matter on my glove, I would note the color and then send that off for occult testing. Okay. That's all I have for today, Mr. Doe. Do you have any questions for me? Okay, I'll go report my findings to my preceptor, and we'll be back with you shortly. You have a wonderful day.